there. It has been 1 week exactly since my surgery, and so I'm making this video to kind of go over how things went and how I'm doing, and yeah, just to give an update. So last Wednesday, I went in for my DIEP flap surgery at Methodist Hospital, and we got there at 6 a.m. and had to do some paperwork and check in. And then we were taken back within an hour to a pre-op, like private room. And they started prepping me for my 8 a.m. surgery. So Paul was able to be with me that whole time. And PRMA works really closely at Methodist Hospital, and they kind of have like their own, like, they work with the nurses and the staff there, and they have like their own protocols and procedures, kind of. And so before the surgery and pre-op, nurse went over my medical history with me, and I changed into a gown. And actually, it was interesting, I was changed into like this purple like paper gown, and it's called a bear hugger, and I was like hooked up to a heater while laying on the bed, and I was there like warming me up. I had to put on like compression stockings that went up to like my thighs. They had I had my legs in like I'm trying to remember what they're called. I had it when I was pregnant, or when I was delivering Abby, but it kind of like squeezes your legs every once in a while, like compression, to kind of circulate blood flow. They did an IV. They gave me some medications up front, and just got me all ready. Then the surgery started at 8. Paul was planning on staying at the hospital, but then like every single person that talked to us, every nurse, every doctor that came in, told him he shouldn't stay, and that he should, go back and relax or work or go do this and this. And there was no way he was going to go somewhere and like explore and relax. So he did come back here. They just didn't want, there wasn't a very good waiting area at the hospital, and they didn't want him to be there, for 8 hours. The surgery itself probably took a little less than 6 hours, but then, they had me under a little bit before, and then it takes a little bit of a while to wake up. So it was about 4 o'clock when Paul, when I was in my recovery room, a little bit awake, and Paul got to come in and be with me. And so again, they took me back around about 8, and then at 4 o'clock he was done. Everything went as expected. There were 0 surprises, and 6 hours is pretty quick for this type of surgery. I mean, I have heard of some women being under for like average 8 to 12 hours, and then sometime as long as like 16 hours. And I think usually that's when things are a little more complicated. And the biggest thing that my doctor was concerned with was, because I had radiation on my left side, I guess your blood vessels are always smaller on your left side, and then when you add radiation and like 2 surgeries to that, it might be trickier to connect those tiny blood vessels to the new flap. And so but everything went really well with that. I woke up, and I was just like super groggy the first couple days, like just in and out of taking naps and sleeping. Couldn't really, it was interesting, like Paul and I laughed about it now, but like I couldn't really talk and take big breaks in between talking. And I think it was like the coming off of anesthesia for being under so long, like the longest I've ever been. I would whisper talk like this, and like not finish my thoughts or sentences, and just kind of not make sense the first 12 hours or more after surgery. And I was not good company. Like Paul was pretty lonely. He was there the whole time, but it's not like I was like chatty or anything like that. The nurses and staff were wonderful. The first like 24 hours, they came in every single hour to check me. And so like throughout the night too, they have to do like a breast check every single hour. And so they come and like take off my binder bra and check everything. They would do like a Doppler on it to make sure blood flow was going, check the color, check the like firmness, and make sure like everything was warm and it wasn't like cold and not working correctly. And so it was quite a lot, but honestly, they would come in and I would like smile, and then like they would do their thing and I like wasn't moving. I was probably like sleeping in and out, and it would be quick. I was hooked up to so many things. I did not expect that or like prepare myself for that. So first I had on, since I had on those leggings, and then I had over top of it these like compression, don't know what they're called, but it like helps with circulation. They want to make sure you don't get like blood clots and things, and so it would like squeeze my legs and kind of make a noise and then stop, and then a couple minutes later like squeeze the other leg. So that was like two kind of tubes going from my legs. I had a catheter for about 24 until the second morning. So the surgery 8 a.m. Wednesday, and by Thursday morning, yeah, I think Thursday morning they removed the catheter. So I had the catheter. Then I had an IV, obviously, and they tried to get it in my hand, they tried to get it in my arm, they couldn't, and so they ended up going like right in the crease, which is like an easier spot. And so that was just like, I don't know, kind of like when you can't really move your arm, and it's just always in the way, I feel like. I also had oxygen, so I had like the thing up my nose. I had 2 sensors, kind of like sticky lights connected to my breast that were like hooked up to 2 machines that were monitoring blood flow and circulation and everything to my new flaps. And then I had, I'm trying to think, so then I had 3 pumps, Boley pumps, I think what they're called. They're like, or not pumps, I'm sorry, 3 drains, which I went home with. And so 1 from each breast, 1 from the abdomen. And I had those for a week. And they would like every, like, I don't know, 6, 8, 12 hours, they would come and like empty them and measure. Then I also had a womb vac that was on my abdomen incision, and it helped. I think they called it like negative pressure, and I also had medicated gauze. But basically my whole like stomach was covered in like saran wrap, and then this womb vac that was attached to a battery that I wore on like a necklace or like a lanyard. Yeah, and so that is just quite a lot of things that I was attached to. And then finally by like the Friday morning, we went home Friday afternoon, I think it was, but like by Friday morning, I sold the sensors and the IV, but they had removed the catheter, which was nice. And then I think they removed the leg, like the calf pump or whatever thing it's called. So yeah, I don't remember much from the hospital. Like I said, I was just so out of it. Then Paul drove me home. So after 24 hours of checking you like every hour, then they came in and checked every other hour, and everything was looking good. My surgeon came in the next morning to like talk to us. They also kept Paul in the loop during surgery. Every like 2 hours, they'd give him a call. There was like a nurse that we met before, and that was like her job, was like every couple hours, like update Paul and where they're at in the procedure, and like tell him when to come back and everything like that. So that was really helpful. And then after the surgery, the surgeon called Paul and kind of went over everything. The biggest like uncomfortableness I had at first were my abs. Coughing was, you know, when you wake up from surgery and you're under anesthesia, you kind of have like gunk on your lungs and you need to like clear it. Oh, but coughing hurts so bad, and it was just like so painful. And then I come to find out, my doctor told me I had a little bit, I can't remember what it's called, diatis recti, I can't remember the name of it, but like when you have babies, sometimes you get like some ab separation, and you get like your abs like start to pull apart, like especially happens after you have kids. And they fixed that during the surgery. I didn't ask, but they fixed it. And so that is like, he said, well, I'm probably having a lot of upper ab pain. And still, that's probably like the biggest complaint I have now, but it's getting way better. I had a cold before, but it went away. But then still, every once in a while, you just gotta like clear your throat and cough, and it just hurts so much. The other thing at the hospital was, it was so weird. I could not see close up. I am nearsighted, and so like I have glasses I wear just when I drive or at night, or if I go like see a movie or I'm in like a big audience and I'm sitting far back. It's a little tiny blurry far out, but like it's not even that bad. But I've always been able to see up close just fine. And it was like, could not see anything. So I could not look at my phone. It was like when I looked at my phone, everything had like lines through it. Like I couldn't even see pictures, nothing. And so so I talked to them about that, and they said that probably the biggest thing was they gave me one of those nausea patches to put behind your ear at the hospital. Like the anesthesiologist put that on, and it was supposed to help, but they ended up taking it off a little bit earlier because they think that was like I had a little side effect. I also had like and you can get like dry eye and dry mouth from that too, and that can just combine with, I guess, anesthesia was just like so bad. So it took probably like a good 3-4 days before it like completely went away. That was very hard. My movement was just restricted. My legs were completely swollen from being like pumped with like saline and fluids for a couple days, and just generally felt like tired and weak. So we came back from the hospital back here, and the first couple days I just like took a lot of naps and rested a whole lot, and then like day by day I just started feeling a little better. The biggest thing they wanted me to do is to like get up and move every couple hours and like take walks, and it was just harder than I thought just to like bounce back for those first couple of days. I am doing so much better now. So every day just got a little bit better. Every day started to like stay awake a little bit more, more lively. My appetite was generally okay, and was able to like be more of a good conversation partner for Paul. And so we came home Friday, like Saturday, Sunday it was pretty quiet, and then like by Sunday night, Monday I started feeling so much better, and then yesterday, which was Tuesday, I was feeling great. And the best thing was that my pumps, my drains, once your drains are under 30 cc's for like more than 24 hours, like 2 days in a row, like each drain under 30 cc's of fluid output, then you get them removed. And like my other surgeries, I've always just had one drain, and it's always come out within like a week, like 5 to like 7 days. And so I was praying and hoping that this surgery would be similar. My body would continue to heal like pretty quickly, but you never know. This is a pretty big surgery, and so I just didn't really know what was going to happen and didn't want to expect too much. But I have 3 drains, generally 4, but I just have a smaller, I'm like petite. My like abdomen is just like smaller and compact, and so they only did 1 drain down like in my belly basically, and then 1 from each breast. And so I got them all removed yesterday at my post-op appointment at PRMA. The nurse removed them all, and it does not hurt to get them removed at all. I've had other ones removed. There's a stitch that they cut, and then they just slowly take it out, and like you more feel like a sense of relief because they're so uncomfortable, and you have things like hanging off of you, and I couldn't like even fit like t-shirt, so I had to wear a I had a abdomen binder, a compression bra, and I'd wear like a men's like undershirt cut down the middle, like under it, for like kind of protection and like being comfortable. And but then once you have the drains, which I'd like keep clipped to a lanyard, I like couldn't even put like anything over it without like having my drains all sticking out. I just did not like them, and they're just like always with you, always hanging off you to shower with them and everything. Anyways, I got all 3 of them removed, and then the pump generally lasts, first they said like 4 to 5 days, and then some of my paperwork said like 7 to 10 days, and so the surgeon decided just to go ahead and remove it. it's not like going inside of you, it's just like on you. And so like the nurse turned it off and then like peeled away all of the tape and the like saran wrap all over my stomach. It was like taking up a lot. And so then I actually could see my abdominal scar. And so now I'm able to wear, I still have my like abdominal binders and I still wear my bra, but we went to Walmart yesterday and bought some like shapewear underwear, like high-waisted, and that's what I'm wearing now. And it all just seems a little more comfortable, but still kind of adds that like pressure and support that I need for a couple more weeks on my stomach. So post-op visit went great. Nurse, like most people don't get their drains removed from this surgery that early. And so he said I look like I'm 2 weeks healing instead of, 6 days healing. And so I was really happy to hear that. And let me think what else. So basically this week I have not been able to do anything. Paul is wonderful and he is doing everything here. And so like he's doing all the cooking, all the cleaning, all the laundry, helping me get up and down, bringing me pillows, blankets. Of course we have our rose gold bell that he got me. My first mastectomy, brought it here. And he's doing great. He's just the last couple days started to work here remote. And then what else? Okay, so he's like taking care of all. I have a crazy list of medications, like 9 or 10 or something that have different, amounts and doses and times. And so he has like alarms on his phone to help him, and then he has like the chart. I also have to use this breathing, I forgot what it's called, but you like breathe in it. And that's to help, I guess, make sure that you're using your lungs and not doing shallow breaths because it might hurt, so that you don't end up with like pneumonia or something like that. I remember for my first surgery, they didn't give me anything like that. And I like, after a couple days, really did feel a lot of pressure. And so I've been trying to use that when I remember. Paul has been having to like, they taught in the hospital right before we left, like the last thing we did was they gave me a shower, and they like taught us how to shower. Basically I'm sitting down, you're like, they had gave you a special soap to use, and having the water run on your back and not on like your incisions. My hair, it looks okay today, but that's because like 2 days ago, I just had to have Paul like walk him through it. But my hair got like more than it's ever been, got really matted. I had took a shower the morning of the hospital, and then 2 days, that was Wednesday morning, and then Friday morning they gave me a shower, but they didn't do anything with my hair. And then we got home, and then Saturday, Paul gave me a shower, and he tried to do my hair. My hair's curly, and it just gets, from like laying down to basically 24/7, it just kind of got really tingly in the back. And then he did okay, and then I talked him through like putting product in it and like trying to poof it up, but then it was wet, and then I just went back to bed. And then like 2 days later, which would have been Monday, we did a shower again, and he had to like really work out some knots. And I'm gonna have him wash my hair again today. I can do a little, but I'm not supposed to like keep my hands up here a lot, so I kind of have to bend down. I think it'll go a lot better, but yeah, it was bad. And then another thing Paul has to help a lot with is like sitting up. So if I'm like reclined, which I sleep in a recliner right now, just like when that initial, even if I like push the seat up, just that initial like sitting forward, you use your abdominal muscles for that. And once I get in, like, so at first I needed a lot of help, but now like I can do it on my own. There's just like a little bit of uncomfortableness, but I got pretty good at, once I'm in the sitting position, like standing up and using just my lower body. I can't like use my hands to like press down. I can't grab something and pull myself. I'm not supposed to. And so it's just really important that I'm using like all of my excuse me, my lower body to help do that. And since, I don't know, I've done plenty of squats and lots of running, and so I don't have a problem with like strength in my lower body. I don't have any strength in my upper body. Yes, so that is kind of it. Oh, I am generally happy with the results. I mean, it looks pretty gnarly. It's pretty crazy looking. It's not like pretty yet or anything like that, but I can't expect, you know, after this first surgery, because the goal was just to kind of build a foundation. And so as expected, we knew this was going to happen. My right natural side is a lot bigger than my left. They were able to keep my nipple. It looks unhappy. And I have like a rhombus shaped flap like underneath my right breast, like on my breast, but like kind of on the underneath part. And in the next surgery, he's able actually to bury that flap. So instead of it being like this like puzzle piece put in, it will be like one scar. On my left breast, it is smaller. It's not as shapely. He said that it just, because of the radiation, he said there was a lot of skin he wasn't able to use, and that it was pretty scarred and thin. And it makes sense. Like for years, I've had so much pain since my last surgery and radiation, so much pain on my left side, and it just always needed protection. So I honestly feel like this breast I have now is like a protection from like my ribs and everything. But it has like a more of a football shaped flap on it. I got a new belly button. I knew that was gonna happen, but they like, when they like, you know, move all that skin, they like take it from around your belly button as well. And so they actually create a new belly button. So they revealed it yesterday. I mean, it's not looking great right now. We'll see. It's kind of weird. And then I have an incision almost from hip to hip. It's not actually quite too far, but it's just like a pencil line incision. And you know, right now it looks really mad, but you know, as time goes on, it's like healing up. I actually don't have any bandages on besides my binders. And then I have 3 drain scars that, you know, I've had drain scars in the past and they heal up just fine, but when they take that drain out, it's just like a little tiny like circle scar. And right now they're like wounds. I have band-aids on those right now just to make sure nothing like sticks to my clothes if anything leaks. But yeah, so I'm pretty happy. And then also, yeah, I'm pretty happy with the results so far as time goes on. And then of course, we'll be back here in about 3 to 6 months for a revision to kind of even things out and see what else we need. But I definitely am happy. I can say so far I'm happy I did this. This was tough. The hospital stay in the first couple days, it was just so tough. But I mean, I did it, and it's doable, and trucking along. Excited to get back to the girls. We are planning on leaving tomorrow. Originally, we were gonna leave on Friday, but then, you know, since I'm feeling well, we were thinking we were gonna leave tomorrow, but there's a huge ice storm happening today in the area, like crazy amounts of ice on the trees and the roads, and even our power is like flickering here. We're hoping it'll be cleared up by the morning, but if not, we might have to wait a little bit later in the day or just end up leaving on Friday like we anticipated. So yeah, that is an update of what is going on here. Thank you everyone for praying and listening.